As we all know, without oxygen, humans can't survive. Anemia is a blood condition of low oxygen carrying capacity. In a full blood count, anemia is characterized by reduced red blood cell count, reduced hemoglobin, the oxygen carrying protein, and reduced hematocrit, a measure of the proportion of red blood cells in the blood. Generally, anemias are either caused by a reduced lifespan of red blood cell or a reduced red blood cell production. There are three major categories of anemia: mild, moderate, and marked, also called severe. While mild anemias may not present with any signs or symptoms, the common symptoms of anemia split by body systems include shortness of breath for the respiratory system, jaundice, which is yellowing of the skin and sclera, paleness and coldness for the skin, low blood pressure, splenomegaly, which is the enlargement of the spleen. Centrally, there's dizziness, fatigue, and fainting. There's also general weakness of the muscles. And for the heart, palpitations, rapid heart rate, chest pain, angina, and even myocardial infarction, colloquially called a heart attack. Highlighted now are the symptoms presented in severe anemia. After learning the symptoms of any condition, the next question you should be asking is why. Why are these symptoms present, and how are they linked to the pathology of the condition? Well, for anemia, it's all related to the decreased oxygen and blood supply. For example, low blood pressure is a result of vasodilation, where the blood vessels dilate to try and increase blood to the tissues. An elevated heart rate also is a compensatory method to deliver more blood to tissues. Paleness is caused because the body has a lack of hemoglobin, which, as a reminder, is the protein responsible for carrying oxygen, but also gives blood its red color. Therefore, with a lower amount of hemoglobin, the skin turns pale. Importantly, these symptoms listed here are common to anemia, but they are not necessarily present in all types of anemias. For example, jaundice, a condition caused by the breakdown products of red blood cells, is common in haemolytic anemias, as this is where there's a problem with increased destruction of red blood cells. However, it is not common in iron deficiency anemia, where there's a problem with red blood cell production. Okay, let's review the main types of anemias, initially split by their size. If the anemia has red blood cells with a mean corpuscular volume, a measure of size, below 80 femtoliters, it is a microcytic anemia. Normal red blood cells between 80 and 100 femtoliters is a normocytic anemia. Large red blood cells greater than 100 femtoliters is macrocytic anemia. Microcytic anemias include iron deficiency anemia, thalassemia, sideroblastic anemia, and anemia of chronic inflammation. For iron deficiency anemias, iron is an important mineral in heme, which binds to globin subunits and forms the hemoglobin protein. Therefore, without iron, the red blood cells cannot appropriately bind oxygen, causing the anemic state. This type of anemia is common in females of reproductive age, due to blood discharge during menses causing the extra loss of iron. For this type of anemia, iron supplementation is recommended. Thalassemia is a hemoglobinopathy, whereby there is a dysfunction in the production of either the alpha or beta globin chains that constitute hemoglobin. This causes a deficiency in the amount of functioning hemoglobin. Thalassemia is an inherited condition, and iron supplementation is not recommended for this anemia, as iron can cause toxicity. This is because people with thalassemia have appropriate levels of iron already. It's just the iron is not effectively used because of the production of inappropriate hemoglobin. Sideroblastic anemia is a condition where iron is used abnormally, producing sideroblasts as opposed to normal red blood cells. Anemia of chronic inflammation, also called anemia of chronic disease, or simply ACD, is caused by excess cytokines present in patients with chronic inflammation. TNF-alpha and IFN-gamma work to decrease erythropoietin production, a hormone that stimulates the bone marrow to produce red blood cells. They can also cause macrophages to destroy more red blood cells and withhold iron. This overall causes less red blood cells in the blood, hence anemia. Moving on. There are many different types of normocytic anemias. These can be split by them either having an increased reticulocyte count or either a normal or decreased reticulocyte count. Reticulocytes are new, immature red blood cells. They are high in haemolytic anemia, where there is excess hemolysis, which is the destruction of red blood cells. Thus, the body increases red blood cell production, spitting out more reticulocytes, the immature red blood cells, to compensate for the increased red blood cell destruction. In contrast, aplastic anemia is an example of a condition with decreased reticulocytes. This is because the bone marrow which produces red blood cells is affected, and thus reticulocytes and therefore subsequent red blood cells are not produced as much. Next, we have macrocytic anemias, which are characterized by large red blood cells and can either be megaloblastic or non-megaloblastic. On a blood smear, megaloblastic anemias have large red blood cells of an oval shape. These occur when there is a dysfunction in DNA synthesis, which can be caused by folate deficiency or B12 deficiency. Interestingly, megaloblastic anemias can present with hypersegmented neutrophils, where their nuclei have 6 or more lobes. This is because B12 or folate deficiency causes DNA synthesis issues in all cells, not just in the red blood cell precursors. Non-megaloblastic anemias have large, round red blood cells on a blood smear. This can develop due to chronic liver disease, as this can lead to increased cholesterol deposits onto red blood cell membranes, which increases their surface area and volume. Okay, let's wrap up with some important high-yield practice questions. Question 1. True or false? A common treatment for a microcytic anemia caused by thalassemia is iron supplementation. This is false. Remember, iron can cause toxicity in people with thalassemia because these people have appropriate levels of iron already. It's just the iron is not effectively used. Okay, question 2. True or false? Iron deficiency anemia causes jaundice, but haemolytic anemia does not. This is also false. Remember, jaundice is caused by excessive bilirubin, which comes from red blood cell destruction, such as in haemolytic anemias. It does not occur in anemias that have inadequate red blood cell production, such as iron deficiency anemia. Question 3. List 4 common microcytic anemias. 4 examples are iron deficiency anemia, thalassemia, sideroblastic anemia, anemia of chronic inflammation. Videos in the future will dive into these different anemias individually and in more detail, so tune in. Question 4. What are hypersegmented neutrophils and what deficiencies can cause them? Hypersegmented neutrophils are neutrophils with 6 or more nuclear lobes, caused by problems with DNA synthesis. They can be due to folate or vitamin B12 deficiencies. Remember, these deficiencies also cause megaloblastic anemia. Question 5. Chronic liver disease is linked to what type of anemia? The answer is non-megaloblastic anemias. Remember, this is where red blood cells are large and round due to excess cholesterol deposits on their cell membrane. Thank you for tuning in to TRImedicine today, where we think, recall, and improve upon our medical knowledge. I hope this video was helpful for a brief introduction to anemia.